So, like I said before, I pass on the floor to Dr. Perelman, who is a veterinary doctor with Fiber Animal Health Corporation, and he'll be talking about the fast-spreading infectious bronchitis, the pathology, epidemiology, and so on and so forth, as well as the vaccine, IBVR2. And now it's a pleasure to pass on the floor to Dr. Perelman. Dr. Perelman, I hope you can hear us.
Thank you very much. I would like to
see and hear you.
Wait, just let me put it.
Yes, we can.
First, thank you for inviting me to present a very, very important issue that is related to infectious bronchitis virus that is spreading all over the world, and it's called the IBVR2 or variant 2, that originally, what we know about this very, very interesting virus, okay? The virus in general is RNA virus. You know, all the coronaviruses like the COVID or other viruses, they have a very, very highly conserved antigens, but they have also the S1 region that is a very hypervariable region. And this is causing changes in the antigenicity of these viruses all the time. And we can see that infectious bronchitis viruses have been evolving for the last 15, 20 years. But in the last 15, 20 years, the viruses became very different and very, very pathogenic, many of them. Now, we know that these S1 and S2 sites, the virus, what we call the virus spike protein, is an hypervariable region. And even small changes in the epitopes are enough to cause different antigenic requirements for vaccines. So this is a very challenging problem for the companies producing vaccines and for the farmers. Now, we can see here the list of the genotypes of bronchitis. Up to now, we have 6 genetic types from G1 to G6, and the most important and most relevant viruses of infectious bronchitis are contained in the genotype 1. In genotype 1, we have 27 lineages or 27 different variants, that inside these variants or lineages, we have different viruses. As you can see, the variant 1, variant 2, all these 793B, that is the variant 1, the QX strain, they are all contained in the group that we call G1 genotype. Now, the whole genome of the IBVR2, the vaccine that we produce, and the field viruses has a 99.7 identity, okay? The parental virus was called Israel 1494 because it started in Israel. The first time that it was isolated was in Israel. Maybe it was in some other place, but was not isolated. And until we isolated here in Israel in the 96 and later on. Now, all this virus, this problem with bronchitis started in Israel. We are a very, very small country, but we have a lot of chickens. We are a very small country with 200 million broilers and lots of breeders, etc., etc. And we are in the Middle East. We have everything that you have in Asia, in Europe, in Africa. We have it and we get it, okay? Now, apparently the IBVR2 is a deviation or a variation or some mutation of the QX virus, okay? What happened in the Middle East, in Israel in general, from 1996 to 2000, even today? At the beginning, we were dealing all over the world with one strain, and then in the 1996, another strains appeared. And then we have, from the Massachusetts, we started finding the 793B group that belongs to variant 1. And we had vaccines like the 491 that they gave some good results in those times. Then we saw other viruses like the QX strain developing in the 2000s. And then in 2006, we saw a sharp increase in the amount of virulence of these bronchitis viruses. And we isolated what we call then the Israeli 1494-06 or variant 2. This variant is very specific and was not found anywhere in all over the world in those times. But since the appearance in 2006, this variant became the most dominant or even the only virus that we isolate today in the Middle East. Is a very dominant strain. We don't isolate today 793, we don't isolate Massachusetts type, and we don't isolate QX strains, only IB-var. Now, this virus from 2006 to 2010 started to spread in the Middle East, covering Turkey, in the North Africa, in the Arabian countries, and it started moving all over the world. And then in 2010 to 2020, it spread again to Russia, to Ukraine, to parts of Europe, including Germany and Poland and Belgium and the Czech Republic. And then in the last years appeared in Africa and in Brazil, okay? So as you can see now, in this map, this IS1494 is a worldwide problem today. It's a very, very virulent virus. It's a virus that is not responding at all to the old vaccines. It is not responding to the cross-protection system that we were using in the past, using the Massachusetts type and the IB-var one, like the 793 group, etc., etc. So this problem is now a very, very serious virus causing damage in the poultry industry all over the world. Okay, in Africa, you have a lot also of IB-QX isolations because the QX is a similar virus. Apparently, the IS1494 was a deviation or mutation from the QX, and they have some common epitopes. So there is some cross protection between them, and I will show you in the next slides. Let's learn about the disease a little bit, because this is a serious disease. As you can see, these small pullets at the beginning in 2000 and something, I took this picture in a highland pullet flock where we had 35% mortality only from the IB infection. The birds were choking to death, and this is a very serious problem. Of course, this group, these kind of layers, very early pullets, they develop further also reproductive tract problems, and I will show you now. As you can see, the virus causes plaques, tracheal plaques. Within 24, 48 hours, you have foamy exudate in the air sacs. There is no pneumonia, but there is a clog. There is plaques of casein and very foamy exudate forming in the air sacs and the trachea. And the birds choke to death due to this exudate. When you see the trachea from a normal chicken in the microscope, it looks like this. But after they have the infectious bronchitis variant 2, as you can see in this microscope slide, the cilia is completely destroyed. For that reason, the birds become very sensitive to other complications like E. coli, or if you have other problems, the birds can get anything. And it takes a long time for them to recover due to the damage that the virus causes in the cilia of the respiratory tract. This virus is also neurotropic. In the first 24 to 48 hours, you can see swelling of the kidneys. Then you have nephritis, and then you have nephrosis and accumulation of urates in the kidneys. So the kidneys are very, very badly affected by this virus too. And if you see the histopathology, we can see the normal healthy kidney in the right, and you can see the damage of the infectious bronchitis variant 2 kidney. If we compare it just for as a curiosity, what you see now in the blue picture is the kidney of a dead person that died from COVID-19. And you can see that the damage in the kidneys caused by infectious bronchitis variant 2 and COVID-19 in people is very, very, very similar. Okay, it's very interesting. Now, this virus, of course, causing this nephropathology causes a huge urination in the flock. And within 48 to 72 hours, the litter becomes water, becomes mud, and you have lots of mortality and lots of condemnation. In the past, when the peak of the disease, we could see some flocks of broilers or even breeders that they suffer from 20% mortality and huge condemnation rates due to this situation of the litter or secondary bacteremia. This virus affects not only broilers or young birds, it affects drastically the production in layers. What you can see here is a normal curve that is recommended by the breeding producers. And here what you see, this drop in production is induced by infection with the IB-VAR2. This drop in production from 80–90% can go down 30 to 40% in non-vaccinated birds, and these birds never recover. Okay, they can go down 30%, 40%, 20%, and they never go back to the normal line that we were supposed to obtain. Of course, the eggs become very white. If you are working with brown lines of chickens, the eggs become almost completely white. And you can see also a lot of changes in the shape of the shells of these eggs, as you can see in the picture above. The virus is not only causing that problem, it started causing in those times in 2006 to 2010, before we had the vaccines, that specific vaccines that we are now working with them. The virus is able to cause cysts in the oviduct of these chickens, in heavy breeders, in layers, and you can have layers or breeders that look completely normal, but when they reach the time of production, many birds will never lay an egg. And then within some weeks, you can start seeing birds that stand like a penguin, because there is a big, big mass of fluid in the oviduct of these birds. These birds develop huge cysts in the oviduct, and they cannot stand. And then you can have huge mortality and very, very, very low production of eggs. These false layers, you don't see them while they are growing, but if you have a bronchitis case in the young time, when the birds are relatively young, up to 10 weeks of age, many times you will see between 5 to 20% of your breeding birds or the layers showing this kind of problem. This is not ascites. This is accumulation of a fluid in the oviduct, and it's caused by bronchitis. Okay, now what can we do to fight and try to reduce the economic damages that are caused by coronaviruses? The only thing, as you know, is to use good vaccines. That's the only thing we can use now. Now, we did many trials trying to obtain some protection against the variant 2, and we did using the IBH120 together with the D274 together with QX-like vaccines, and we mixed them in many ways. And as you can see from the report from Brew in avian pathology in 2017, the protection that we reached using three different lines, different genotypes, what we got is only 50 to 70% protection when they challenged with the variant 2. So all the cross protection theory that was working maybe in the past is not working anymore for the variant 2. And it's very important to take it in account because it causes huge economic damages. Okay? If we can see here, we did many trials, including control trials. And we see when we use the H120 Massachusetts type together with the 793 that is similar to the 491, we got about 65% protection based on celiostasis. And the flocks in the field, we got about 13% mortality average in all the broiler flocks in the country. It was a disaster, okay? When you mix together twice, when you give twice the variant 1, you can reach something between 70 to 80% protection. The only way we got protection that was acceptable was by using the new vaccine that we developed from the wild virus. We took the wild virus and we did attenuation by passaging in embryos many times, testing every time different passages to see where can we reduce the virulence of the virus, but we can keep the immunogenicity of the virus, okay? And then we got, and we developed the IBVAR 206, that it is a very good vaccine and specific vaccine to deal with the infectious bronchitis variant 2, okay? One thing that is very important to understand when you use vaccines for bronchitis, it doesn't matter what vaccine you use, but the concept of using different strains is a big mistake. And we proved it many times. If you want to get the best protection, you must use several times the same type, the same antigenic type. If it's a genotype or the lineage, you have to use the same at 1 day, 12 days, 3 weeks, 5 weeks, but you have to use it because the protection is based on memory cells and the IgA that is produced in the mucosa. But when you use different types of vaccines, the birds don't develop enough protection to deal with any kind of vaccine. So if you want to use some vaccine, use the same vaccine several times to induce memory cells and a good protection for the virus that you are going to protect against. This is from Israel, what happened in 2006. As you can see here, the virus started in 2006. This is the number of cases that we got in Israel, more than 400 cases with isolations from 2006 to 2010. It was really a really big damage to the industry. Then we introduced the vaccine, the IBVAR2, and what happened is that the introduction all over the farms from day one, in breeders, in layers, in broilers, the disease started going slowly, and by 2012, we didn't have almost any case of infectious bronchitis. The isolations were mainly vaccine strain. What you see here is a very sharp drop. Today, we deal only with very few cases of infectious bronchitis in breeders, in layers, in broilers, with very low damage. The economic damage was really suppressed after the introduction of the IBVAR2 vaccine. It really reduced the number of isolates. And not only in Israel, the same situation happened in Turkey, the same situation happened in Poland, the same situation happened in many other countries where the infectious bronchitis variant 2 started to grow. We tried to test what is the ability of the variant 2, the IBVAR 206, when we vaccinate to protect against QX, because QX is a very common strain even in Russia. And then not only in Russia, or in Europe and in the Middle East, etc. So we use 1 day Tabik IBVAR against 14 days because you have to give it twice. And we proved that in trials carried out in Russia, in South Africa, and in Israel, by application of minimum in broilers, in broilers at the early stage of 2 vaccines, then you get protection against QX that is excellent. Okay, but then you must use the vaccine several times. And we use it here in the breeders and the layers. Every 5-6 weeks, we vaccinate it together with Newcastle or without Newcastle by core spray, by aerosol spray, in order to protect the layers and the pullets and the breeders. And as you can see here, we did this trial against the QX in 3 different countries using different viruses that are local in those countries. Now, what we know now is that we tested also this vaccine compared to the vaccine that is genotype 119, that is the QX vaccine, applied twice. And as you can see here in the data, we got exactly the same level of protection when you vaccinate with a G119 QX strain or when you get the IBVAR 206. Apparently, the IBVAR 206 virus contains the most important epitopes that are in the G119QX strain. So we get a very good protection when you use it normally or combined with the G119. But my recommendation is always to use the TABIC IVVAR 206 several times to provide the maximum immunity that you can get for your flocks. Okay, when we use the cross protection theory, as you can see in red, the genotype 13, this is the 793B applied, it doesn't matter how, we never got more than 66, 70% protection. Okay, the vaccine in general is produced by ABIC in Israel for many years, and it comes in tablets. It is developed from the field strain GI23 IS1494. The minimum dose that we put inside is 10 to the 3.8, is effervescent tablets, and it can be used from day one by core spray or by aerosol spray in broilers, breeders, and layers. Okay, the critical points that we took when we started developing this vaccine was the attenuation of the virus, because the origin of this virus, of this vaccine, is a very virulent virus. We did safety tests from day one in SPF chicks and in broilers, efficacy tests in SPF broilers and breeders and layers, application and optimization tests. We developed vaccination programs, and we are accumulating data at a global level about this vaccine that is in use now everywhere, including Brazil, including Mexico, including Russia, including Europe. And it's an excellent vaccine to control the outbreaks caused by ABIVAR2, or sometimes even the problems caused by QX strains. Okay, now TABIC ABIVAR 206 is maybe, I don't want to say the best, but is one of the best vaccines that are existent today to control infectious bronchitis caused by IS1494, that is called IBVAR2, or by the QX G119 field virulent strains. Thank you very much. If there is any question, you have the translator, and I will be glad to answer any question. Thank you.
Большое спасибо, Бенни. Да, сейчас.
Thank you so much, Benny. Indeed, whether we have any, let me see whether we have any questions in the chat box, because I see that your colleagues are taking questions in the chat box. So one of the questions was, can you administer a vaccine to day-old chicks? And the answer was yes. I guess your colleagues are taking those questions. Let's take questions from the floor. Go ahead. I was just wondering, can you simultaneously use 2 vaccines, IBVAR 206, 494, and Massachusetts? Can you combine 3 vaccines into the same course, spray or aerosol?
Okay, the question is if you need it or not, because there is always some competition between the infectious bronchitis. Now, Massachusetts type is an excellent vaccine virus, and it replicates much faster than the QX vaccines and the IBVAR2 vaccines, even faster than the 491 vaccine. So it is not recommended to apply the Massachusetts type together with any other vaccine of bronchitis, because it will replicate before and it will cause interference with the other strains of the vaccine. So never do it. What you can do is to use variant 1 and variant 2 together, but you have some interference in the first vaccinations. After second, third, fourth vaccination in layers and breeders, of course, for broilers, we only use it twice, 1 day, 14 days, enough. You don't need it more for broilers, okay? Broilers grow up to 40 days, 45 days, and you don't need more than 2 vaccinations, 1 day, 14 days. You can use it by core spray, and if the problem is very serious, you can use it even by aerosol spray, because it is not causing any kind of reaction, no respiratory reaction, okay? Then you can use the variant 1 and variant 2 together, but never, ever use Massachusetts type together with any other vaccine, because Massachusetts type is a very fast replicating virus, and it will inhibit the replication of the other virus in the vaccines, okay? Don't mix too many vaccines. Try to make the first 2 vaccines variant 1, variant 2, or variant 2, or variant 1 twice, variant 2 twice, and then you can use for your breeders, your layers, you can use a mix of QX and variant 2. That's okay. Don't mix too many vaccines inside, because it can cause a lot of cross reactivity, and the fastest vaccine, the fastest virus, will inhibit the replication of the other vaccine viruses. Okay, they will have competition. You don't want the competition. Okay.
Спасибо.
Thank you.
Секунду.
Any
вот.
other question?
Есть еще вопрос, да.
Yes, there is another question. I was just wondering whether you can use IBVAR vaccine for carpet vaccination at different ages of the flock. If there is an outbreak of the infectious bronchitis variant 2, or is it more effective to start with day-old chicks to ensure the protective immunity?
Yes. Now, it depends on the situation that you have in the area. According to the epidemiology that you have in bronchitis, if you have an area that is very crowded with lots of chickens and you have a lot of bronchitis, the earliest time you can vaccinate is the best. Of course, 1 day and 14 days is critical to protect the early stages in any kind of bird, layers, breeders, and broilers. So 1 day, 14 days, critical. You can use the IBVAR2, you can use also the IBVAR1, you can mix them together, but always use them together, okay? So if you use, even at 1 day, you can give the IBVAR2, then 14 days variant 2, and then every 6 weeks in birds that are going to be replacement pullets for layers or for breeders, and in production, every 5 to 6 weeks, you must continue with the vaccination of the IBVAR2 with any other vaccine that you want to protect. Live vaccine, you have to use every 5-6 weeks, because that's the duration of immunity with live infectious bronchitis viruses, okay? Remember that we don't have any IBVAR2 inactivated vaccines, so the levels of humoral immunity are relatively low. What we must do is to protect our birds and the mucosal, the entrance of the virus from the respiratory tract, and we do it using the live vaccines every 5 to 6 weeks at any time. A very important point to understand, if you have a breeding flock that goat is not vaccinated, but you got in that flock in one of the houses bronchitis, vaccinate immediately. Also the building, that building, and also all the other buildings in the farm. This can help you to stop the disease from spreading the same way we do with Newcastle. When you have an outbreak of Newcastle in a farm, the only way to stop it is to vaccinate by aerosol spray, sometimes even with drinking water. If you don't apply it very good, the aerosol spray is useless. You have to use it and apply it very, very good, a very good vaccine applied by aerosol spray and even drinking water. But with bronchitis, the same thing. The moment you see an outbreak and it starts in one building, vaccinate all your houses and revaccinate 2 weeks later if they were not vaccinated before. And this can help you to stop the spreading of the disease between the different buildings. Other questions?
Еще вы показывали гистологические
He also
исследования.
demonstrated the results of the histology, kidneys in a healthy bird and kidneys of a bird infected with COVID-19. So I guess you isolated COVID-19 in poultry, or did you try to reproduce the infection process?
No. I just, because the virus is a coronavirus, okay? Coronaviruses, I can tell you something. I have no idea why I never got corona. I was in contact with lots of people, maybe because I work a lot with bronchitis, okay? And I was breathing these viruses all my life. But I just put the slide of a kidney of a person with COVID that died from COVID to show you that infectious bronchitis variant 2, okay, this variant is extremely virulent for the kidneys. It's a nephropathogenic strain, not only respiratory. It's nephropathogenic, it's respiratory pathogenic, and it affects very badly the reproductive tract of the birds. It also causes, it has a very bad effect on males. It can cause sterility of the males. When this virus enters in a breeding flock, sometimes you don't see nothing, only maybe some drop in production, and sometimes some shells that go wrong, but in breeding flocks, you will see a sharp drop in the fertility because the virus is affecting and destroying the cells that produce the sperm in the males. So males and females must be vaccinated against variant 2 to prevent the damage to the testicles of the males, not only the females.
Спасибо
Okay.
большое. Да, секунду.
Thank you so much. Hold on a second. We have another question from the floor. Good afternoon, and I was just wondering about the following. You mentioned that Ibivor 2 should be administered on day 1 and day 14, and it should not be mixed with other vaccines. But in Russia, what we see is the circulation of Massachusetts strain, that's 793B. But if you're saying that we cannot mix it with anything, how do we protect our flocks against Massachusetts strain? Do we use Ibivor 2 only?
No, I will tell you what. I'm not in Russia, so I don't know exactly the Massachusetts type that is isolated in most countries today. In most countries, I don't know exactly in Russia, but in most countries, it's vaccine virus, and this is a very problematic thing because the important thing is to understand what virus is really causing the problems. Now, if you have a problem with Massachusetts, is quite outstanding in most of the countries in the area of Europe and the Middle East and Africa, and even in other countries now all over Europe, including maybe in Poland, in Germany, etc. Most of the viruses are IBV 793B that belongs to the 491, that is variant 1, and you have the variant 2. There are very few cases reported today of disease caused by Massachusetts type. I would do, in your case, if you are not sure, I would give the variant 1 and variant 2 mixed from day 1, then 14 days, and for breeders and layers, replacement pullets for breeding for layers, I would do it every 6 weeks or 5 weeks, repetition of the same vaccines to provide the maximum protection to my flocks. But if you mix the Massachusetts, you may affect dramatically the effect of other vaccines. It doesn't matter if it's QX vaccine, variant 2, or variant 1, because Massachusetts vaccines replicate very, very quickly in the trachea. So you can use Massachusetts the first time, but then you have to start vaccinating with variant 1, variant 2 together, or variant 2 minimum, and one vaccination after the other, because the only way to provide protection is by continuous vaccination and the creation of memory cells and the IgA that produce in the mucosa. You must protect the respiratory tract. The only way to do it is by replicating the vaccination with the same strains.
Спасибо большое, Бенни. Тогда
Thank you
дополнительный
so
вопрос.
much, Benny. Just a follow-up question. So we cannot mix Massachusetts with other strains, but
No,
can
but you
we
use-
can we mix your IBR vaccine with other vaccines against the Newcastle disease, the
Yes,
Rio
yes,
virus, for
yes,
instance?
no problem. With Newcastle disease, we use all the time. The only thing is with bronchitis viruses that they compete with each other. You can use Newcastle bronchitis from day 1, then 14 days Newcastle bronchitis. Yes, you can also mix variant 1 with IVR 206 together with Newcastle and give it by course spray with day 1, then 14 days. Give it again, whatever you want, the IVR 1, IVR 2, then you replicate 21 days. You have your Newcastle vaccinations, and you can start using it every 4, every 5, and 6 weeks together with Newcastle. Together with Newcastle, no problem. You will get very good response to Newcastle, and you will get very good response to bronchitis.
Спасибо большое.
Thank you so
Вопрос?
much. Any other questions? Any other questions from the floor? Well, thank you so much. I'm sorry, we have another question. I did not see the person raising
No
his hand.
problem.
So what we're saying is that even neurotrophic strains of infectious bronchitis or can be found in the gastrointestinal tract in high concentrations. And I really doubt that aerosol vaccination is more effective as compared with the drinking water vaccination. Have you ever compared the aerosol administered route and the drinking water route? And is it possible to use your IBR2 vaccine in drinking water?
Yeah, but you can use it, okay? But you have to understand that infectious bronchitis viruses are not exactly like Newcastle. Newcastle replicates very good. It's an enterotropic virus. The VH or the Lasota or other strains that you are using for Newcastle are enterotropic strains. They can replicate in the intestine. Bronchitis it has less ability to replicate. So it's always good to give it by aerosol spray when you have a problem. You can also give it in the water. Now, the first vaccination, 2, 3 vaccinations, 4 vaccinations, give it in the aerosol. And after then, you can use it in the water together with Newcastle, okay? We do it in breeding farms or in aviary cages when we cannot use the aerosol because we have open houses and it's very complicated to make aerosol in those farms. We use it in the water, mixed with Newcastle in the water. The efficacy is a little bit less, but it can be used in drinking water. But the first vaccinations, 2, 3 first vaccinations, minimum, do it by course spray and aerosol spray so that you can induce the protection in the respiratory tract, not only in the digestive tract. It's very, very important to induce protection for your chickens.
Все, да?
I guess we are out of question. Let me take another look around the room. Anyway, we're out of questions. Thank you so much, Dr. Perelman. And we really hope this is not the last time you have participated in our conference.
Okay, thank you very much. And thank you for inviting me. Bye,
For your
see you.
support, for your attention. Goodbye,
very
good
much.
luck. Have a nice day.
Bye.